about.
In today's news for you, when should you call 911? We're working with Lexington Medical Center to Take 5 for Heart Health. Jamie Jeffcoat is with the Center for Best Practice at Lexington Medical Center. And Jamie, I mean, it is a really good question. How do I know if someone's in trouble, whether to call 911 and wait for an ambulance or to try to get that person to the hospital myself?
That's a great question. EMS now have capabilities via the radio technology. They also have EKG technology on the truck that actually help assist a patient if they're having a heart attack to get fast treatment.
So your warning to us or encouragement to us would be go ahead and try to get that ambulance there first before I try to put the person in the car.
That's correct. Studies actually show that folks who have EMS treatment in the field, and field meaning anything pre-hospital, folks who have that kind of treatment actually have better survival rates.
Which shows what the treatment does by getting it sooner as opposed to me just having the person in the car.
That's correct.
So I've called 911, I'm waiting for the ambulance to get there. I feel helpless. What can I do until the ambulance and the paramedics get there?
That's great. A lot of folks feel comfort when others are there. If they're not able to be in the comfort of another individual, take it easy. Folks should be able to sit down, take a break, not exert themselves. And if, like any typical household would have, 4 baby aspirin. If they're not allergic to it and their doctor approves, can take 4 baby aspirin. And that's an immediate treatment that folks can take if they're having symptoms of a heart attack.
There's so many things, so many variables, because I'm thinking, okay, do I move the person? Do I try to get this person out of the way? You know, or like you said, give this person some kind of medication like the baby aspirin?
Correct.
I guess is it just that comfort of talking to the person, holding the person's hand has got to be really key and just comforting him or her.
The stress of somebody in pain like that, if you've ever had this kind of pain, is very stressful. So to be able to talk to somebody and have that comfort level, it reduces the stress level, which also reduces the stress on the heart.
Which is a really good point.
Correct.
So you're doing more than you really realize
Indeed.
you are. Well, you guys are having all these heart health topics at Lexington Medical Center for a heart fair that is coming up. It is this Sunday. The information is there on your screen. March 2nd from 1 to 5 p.m. at the Doubletree by Hilton, which is on Bush River Road in Columbia. Again, Lexington Medical Center's Heart Fair. So, Jamie, thanks for this information. What we're going to do is take a break, and then we're going to let Ben do weather. And then when we come back, we're going to give you a look inside the hospital, or excuse me, not the hospital, we're not going there, inside the ambulance and the EKG machine that may be used on you in a heart emergency. Jamie, thanks so much.
Thank you.
Great information.
Appreciate it.
Ben?